what's the prevalence of patients who have peripheral arterial disease and chronic kidney disease? I assume that means a combination of those two. But let's talk a little bit about both separately. So the incidence of peripheral arterial disease in the United States today is about 5%. Now, this includes patients who may or may not be symptomatic at the time, but if you screen the patients and did tests on them, you'd find about 5% of patients have peripheral arterial disease. Now, if you look at a smaller subset, so patients who are above 70, about 15% patients will have a peripheral arterial disease. Now, as far as the combination of peripheral arterial disease and chronic kidney disease, if you have patients who are on the borderline, meaning stage 3 and stage 4 kidney disease, in other words, they're not on dialysis yet, but have evidence of significant kidney disease, about 25% of those patients will have peripheral arterial disease. And then if you talk about patients who are actually on dialysis, up to 45% of those patients will have peripheral arterial disease.